Good morning, you guys, it's Karen, and this is it's not the final video, but it's the penultimate video in the Blepharoplasty eyelid surgery series, if you like, because I have had my final review with the surgeon, and I also had a second opinion consultation with another company. So I'm going to tell you what they said and show you the final kind of before and after pictures and tell you where I go from here. So I put everything on Instagram yesterday, and you guys know that from pretty much day 2, or as soon as I could see my eyes, I was disappointed. I felt that I wasn't sure if it had gone wrong. I just knew that my eyes to me looked as hooded as they did before. Now it's difficult because they don't look hooded when I'm talking, and you guys are lovely and you're always giving me compliments, and I can see when I'm talking, like when I'm talking now, I raise my eyebrows and they don't look hooded and the results look great. The problem is when I'm relaxed and when I take photos, and you know, when I'm not animated. That was always the problem. But I could see that I hadn't got the result that I wanted. So when I went to have my stitches out, the nurse, I mentioned it to the nurse, and the surgeon was next door, and he popped his head in and said to me, oh yeah, it looks like you may have brow compensation. Now, do you remember, he'd never told me about brow compensation, and I came home and looked through my paperwork, or looked to try and find paperwork, and I hadn't got a copy of it. Now that's my fault. I should have got a copy of it. I was way too obviously impatient on the day, or not paying enough attention. I don't know what happened, what I did with the paperwork. I'm pretty scatty a lot of the time. Normally that would be the kind of thing I would pay attention to, so I don't know what went on, but I didn't have a copy of the paperwork, so I couldn't check whether it was in the fine print or not. But I know he didn't tell me about it, because I know he was quite rushed on the day, because I remember him saying something like, yeah, we don't need to worry about that, just sign there, kind of thing. I should have at that point gone, hold on a minute, let me go through it all. But the thing is, had he have said, there's a chance that your brow will drop after I've taken the skin off, I would have gone ahead with the surgery anyway. I wanted to tell you this in another video, but I completely forgot. Yeah, you know, I would have accepted that risk and gone ahead anyway. So basically I was told I needed to wait until this review appointment that I had yesterday, because he wouldn't consider anything until the 4 months had passed, because that is the point where absolutely everything has healed. Everything has relaxed back into place, and it's only at that point he will consider any kind of revision. So I came and did my updates with you guys, and I said to you, I think that I've got this brow compensation. You know, I think that Botox will be the answer. I took photos and I felt like I had lost this space here between the top of my eyelid to my brow. I felt like had reduced. I felt like if I compared photos, I could see there was less space here. So I felt like having Botox would like lift my brow up back to the position it was in before, and that would then really give me the result I wanted, because I could see that he's done a great job here, but that because my brows have come down, it looks no different. But a lot of people were telling me, it's the swelling, you're being too impatient, you're only a week out, you're only a month out, you need to wait. Once the swelling's gone down, you'll notice a big difference, and you know, a lot of that. There was also the additional problem that I still have. Do you remember where I showed you where if I raise my eyebrows and I look down, this happens? So I went into my review yesterday and he asked me what I thought, and I said to him, well, firstly, I said, I'm really disappointed. I said, because my eyes are as hooded as they were before, but now I actually have less space. I said, and additionally, I have this problem with my eye that I'm really quite worried about. I said, because it's something that has actually got worse since the operation. I said, it started off mildly, but now I can see when I take photos sometimes, I can see that my right eyebrow is actually lower. I said, so that's probably more concerning. So he said, yeah, he said, unfortunately, it looks like you have had brow compensation. And he kind of explained to me how it worked, and it wasn't what I thought. Actually, I thought it was that you cut away the skin and it pulls the eyebrow down. It's not. He said it's actually something about your brows working to hold hold things up, but where you take the skin away, it made sense when he explained it, but I'd looked it up before and it made sense. So basically it's brow compensation, which is what I had thought. And he said it looks actually like they've gone a little bit lower than they were before. And I was like, yes, that's what I thought. And he said, I know the thing that will work for you though, Botox. And I was just kind of smiled and I was like, yeah, that's kind of what I thought. He doesn't do Botox. They don't do Botox there. It was Bupa that I went to. It was the Spire Murrayfield in Edinburgh. So it is a Bupa hospital. I thought I was doing the best thing going to a medical hospital where I had my knee surgery. And my opinion has now changed on that and I wouldn't go back there. And you'll understand why, I think, as I go on with this conversation. He definitely became more cocky in this follow-up. And I already found he had an air of arrogance around him. But, you know, having worked with surgeons in the past, I always found that surgeons had an air of arrogance. There was very few surgeons. I can't actually think of any that I worked with that weren't arrogant. But some of them you would then see with patients and they were amazing. But with staff, they all had a God complex. But he was just he actually said the words, I think I've done a great job, which I was like, oh, really? But I do think he has done a good job. I do really think he's done a good job. So yeah, he recommended Botox. He didn't offer any compensation, any free anything, but then there wasn't anything to offer. So as far as the surgery went, he said, you've just been one of the unlucky ones that has got this brow compensation. And he said it could well be to do with the Ehlers-Danlos because your skin will relax more. And that is true. You know, my skin, Ehlers-Danlos is a connective tissue disorder and my skin is more elastic, if you like, so it will have relaxed more. He talked about, you know, I said to him, well, what about, you know, brow lift? What would you think about that? And he said, well, I said before the surgery that you weren't a good candidate for that. And he said, I'd still stand by that because I don't have any horizontal lines. And he said there's not enough to do a full brow lift. He said, because that would just look really, really unnatural. And so to do that, you know, the one where they just go in like endoscopically, he said, that would be really tricky to get the right balance. It just would maybe look too unnatural. He said, that's why I'd recommend Botox. But then additionally, because of this muscle problem or nerve problem or whatever it may be, he actually said he wouldn't operate on me again because he has no idea what it is. So I showed him it and honestly he looked at me like I was something out of a circus. I showed him and he just looked, he was like this. I laughed, but I kind of wanted to cry. I was like, you don't know what it is, do you? You know, and he was like, I've never seen anything like that. And he was like, do your little trick again. And I was like, it's not a trick. It's like, that's not a trick. It's something that's wrong. I said, and it's something that's worrying me. And I said, I now can't do photos. I said, I like to take photos of my eyeshadow with my eyes closed. And he said, well, you can close your eyes. Well, I can close my eyes with my eyebrows down like that, but that's not exactly a great photo of my eyeshadow. I like to take a photo of my eyeshadow with my eyes raised and my eyes closed, but that's not a great photo either, is it? You know. But he just said, I don't know what it is. He said he did some tests. He got me to follow his finger and he said, you know, as far as I can see, everything's working. And he said, the muscles are working. And I said to him, well, clearly the muscles are working. I said to him, but what about the nerve? You know, I said, it seems more like a nerve to me. And he said, well, yeah, I guess a nerve could have been excited by the blah, blah, blah. And he said, but I just don't know which one it would have been. And I don't know, his response to the muscle or nerve or whatever it was problem is what I'm upset about, because he basically just said he didn't know. He said, I don't know what it is, therefore I can't offer any solution to undo it. And so he kind of was like, you know, it was like that was the end of the consultation. And as I was leaving, this was the bit that added kind of insult to injury. And I said to him, can you know, if you find anything out, you don't have my number or anything. I said, but the receptionist has my email, because I did email in. You wouldn't normally take my email. but can you let me know if you find anything out? Because I said, I'm quite worried about it because it seems to be getting worse. And he was like, oh yeah. He should have offered that to me. You know, he should have said, let me talk to my colleagues, let me look into it, and I'll get back to you and see what I can find out. But he didn't offer any of that. But then he shook my hand and said, sorry, it wasn't perfect. And I was like, oh, you arrogant twat. That's what I thought. Excuse my language, but that's exactly what I thought. You arrogant twat. What a thing to say. Sorry, it wasn't perfect. I showed him the pictures that you will see. Clearly it's not perfect. There's no change. The slight change is at the corner of my eyes. There is less wrinkles. However, there's also less space. Before I had, you know, wide eyes but hooded. Now I've got less space as hooded. So you could say that this is better, but I've got less space. So we're kind of in the same position. Before you start, because I know there will be some of you out there going, you should have demanded that he gave you your money back. You should have gone in there and said, this is what I wanted, you didn't achieve it, therefore you should give me my money back. I don't think that that's the case regarding the eye surgery, because I want to look like Pamela Anderson. Life is not like that, you know, you can't perform miracles. I know that the brow compensation wasn't his fault. Like, I understand that he's done a good job with my eyes and that he can't prevent brow compensation. That is just a thing. Maybe he should have told me about it, and he didn't, but that wouldn't have prevented it happening, and it wouldn't have prevented me having the surgery. The thing that I think he should have offered me as a gesture of goodwill, I think he should have offered me a partial refund, because for this eye droop alone, I will need to have Botox so that I can take the photos. So to put me in the same position as I was before, I will need to have Botox to stop that droop happening. To get a good result, I will need to have Botox, and that will make me happy. And so I think as a gesture of goodwill, he should have offered me that, but I did not want to sit and demand that from him, because he knows I'm a blogger, and he said, you're going to give me a bad review, aren't you? And I said to him, not necessarily you. I said, I'm talking about the procedure and the company as a whole. And he said, oh, I'm a big boy, I can take it. And I thought, well, you wouldn't really have mentioned it if you weren't bothered by it, you know. But I am going to complain to Spire about it. So it's Spire Healthcare, and it used to be called Bupa Murrayfield. I'm not sure whether Spire Healthcare have taken over Bupa. I'm not 100% sure. When I worked at the NHS, it was called Bupa Murrayfield. So I'm not sure exactly who owns who and who is responsible now, but I will figure it out, and I am going to complain because, like I said, I think because of this eye droop, I should have been given some feeling of security that it seems to me that he's caused potentially permanent damage to my eyes, especially since I said to him, what about nerves? And he said, yeah, it could be. And then just let me walk out with no kind of comfort at all, no comforting words at all. Anyway, so that's him. Put that aside, I was so glad that I had already organised my second opinion. And I actually didn't feel like I really needed a second opinion, because I was quite confident. I felt like it was a pointless consultation that I was going to see the guy. I felt like I knew that it was brow compensation. I knew there was nothing he could do. I knew that he wasn't going to offer me anything. And to have a kind of, I suppose that's a bit arrogant of me to think that, because who do I think I am? But maybe that's why I went, because I thought I need to get the actual professional's opinion. And so I had made this second opinion appointment with Transform. Now, Transform is where I had my original consultation for the very same surgery, but 3 years ago when I left the NHS. So when I first got my redundancy, I was going to have this done, but then Kev lost his job, so we couldn't afford it. That was the one that was going to be under general anaesthetic, and it was with a lady. And so I had made the consultation with a lady, and I couldn't remember if it was the same one, but it was. And so I thought, I'm going to go in. I'm obviously going to tell her I've had the surgery and give her the full details, but I'm just not going to tell her that I've been for my review yesterday and you know what he said, I'm just going to see what she said. I'm just going to say, I've had my eyelid surgery. I'm not happy. I feel like I've not got any results, and see what she says. So, and it was a free consultation. Transform is a free consultation. I actually paid £200 to get a consultation with at the other place. So she had a look. She did a lot more testing, I have to say, but she said it's a great job. She said your surgeon's done a great job. She wouldn't have done it under local anaesthetic. She doesn't agree with that because she said, fun enough, she said any movement, she said there's so many like nerves and things there that she says you can like any movement of the eye, or if I'd have got a fright and jumped at something and you're there with a scalpel, you know, you can catch something, which she did tell me at the time. That's why she only does it under general anaesthetic. But she said, you've got brow compensation. So she said that before, like I didn't tell her that. I never used any of those words. I just said to her, what do you think? I showed her the before and after pictures. And she said, you've got brow compensation. That's the risk of having this surgery, but he's done a good job. I showed her the brow thing, you know, the droopy brow thing, and she doesn't know what it is either. Well, I forgot to tell you what he said. He was kind of blaming the Eyelid loss, and I felt like it was a bit of a cop-out. It was kind of like, oh, it must be something to do with the Eyelid loss. She knew about the Eyelid loss as well, because obviously I told her when I went in the first time, as though she still had the notes. She didn't mention the Eyelid loss, but she did say, I don't know what that is at all. She said, I've no idea what it is. And she didn't really offer anything else, but I wouldn't expect her to, because I was just getting a second opinion really on, would it be worth having another surgery? What would be the solution to the fact that I haven't got a result from having, I haven't got the result I wanted from having blepharoplasty. So her solution, Botox, exactly the same as him, exactly the same as what I said. She said Botox, or she did say she could do not the full facelift. She also said that the full brow lift, sorry, she wouldn't recommend, but she said she could recommend doing I think it's the endoscopic brow lift. It would be under general anaesthetic. I think this woman doesn't do anything under local, but not until I'd had Botox first, because she said with Botox, you can see if you like the result. And if you like that, you know, like get your brows raised. If you like it, have the brow lift done, the endoscopic brow lift, and then that would be like a permanent way of having the Botox. I can't afford the brow lift anyway, so that's kind of a moot point unless I end up getting compensation from, you know, unless I end up getting some kind of refund from Spire, Bupa, whoever they are. So it might sound a bit weird, but I'm actually really happy, because I've never been like, I was gutted by it, but I haven't spent like ages being depressed about it, because when it first happened, I was a bit sad, because like Kev got a bonus from work and that's how we were able to afford it. And so I just think it was the sweetest thing. You know, he knows how much my eyes have bothered me. He got this bonus and he was like, right, let's get your eyes done, you know. And so I didn't want that to come to nothing, you know, because that was an amazing gift he gave me, you know, and so I wanted that to mean something. And I just don't like wasting money, you know. To me, it was just like £2,000, poof, gone with no result. It would be totally worth it if I'd got a result, but we can't just find £2,000 from anywhere, you know. There's so many other things I could have spent that on. So that kind of bothered me for a while, but not from the vanity side, because I've got so many health issues, and I feel so lucky in so many other ways. That side isn't going to necessarily bother me. And then Watson got cancer, and so that put everything in perspective. You know, after I had the surgery, it was on the day I was due to put makeup on Christmas Day, Boxing Day. It was the day after Boxing Day we found out Watson had cancer, and it was like, who cares about bloody eyes and makeup and all that, you know. But now, having seen the surgeon and whatnot, it's given me a renewed confidence in myself, because I was just, like I said, I was so nervous going to see the surgeon yesterday, because I knew that everybody in the waiting room, like there were all these women in their high heels, and I can't wear high heels because of my orthotics, and you know, I feel like they were all there for their plastic surgery, and I was convinced that they all go there like once a month and have procedures because they can just afford whatever they want to have done. And I felt inferior. I was saying this on Instagram, and you know, like I used to feel that way going to like the Estee Lauder and the Dior counters and that, you know, and I feel that way going into plastic surgery offices and that kind of thing, you know. And I felt that way yesterday. I felt that he was just, because they all just have a brow lift, as if to say you can just produce thousands of pounds all of a sudden. Where am I going with this? I know, but having had these 2 reviews, it's given me the confidence that I know what I'm talking about. I know my face, and I can trust my gut instinct. You know what I mean? I knew that it wasn't right, and I knew that Botox was the way to go, and I'm now really excited about that. And I feel like just that tiny little lift to put my brows back to where they were, I think that will give me exactly what I was after in the first place. So I'm really excited about that, because actually my eyes, when lifted, it's a really good job, you know. And so I'm bummed about the fact that I'll need to spend money on it, because the point was to never need Botox again. But all is not lost, I suppose is what I'm saying. And I've also learnt that I thought it was best to go to a medical place. You know, it was a hospital where people were also having, like I did, knee operations and hip operations. But Transform treated me so much better, and I've had my lips done at Transform as well, and I feel like the experience there is so much better. They just, from the reception to the nurses to the surgeons to every part of the procedure, I just feel has been more pleasant, more professional, nicer, you know. I've never had any major surgery there, so I can't say that part would be better, but I just feel like it's been a nicer experience. So if I was having anything done again, I would definitely go to Transform. So my Botox is booked for Monday evening. It's with a guy that I have never been to before, which you might think is crazy, but I don't have anybody that I used to go to, because all the people that I used to go to that were good no longer do it. There was 3 people. I went to 3 different nurses that were fantastic, but they all went back to work in the hospital and gave up doing Botox, which was so annoying. But there you go. So I'm going to this guy, but he comes highly recommended. 3 people have recommended him that I know, so that's good. And, you know, I've seen pictures on his website and pictures on his Facebook page, etc. So I have high hopes, and I'm also, you know, I know where I need to have it done. I don't want anything here, like nothing in my forehead, just along the top of my eyebrows, in the middle here. I might have my crow's feet done as well. I'll see how I feel on the day, because that's quite painful. I find that quite painful. And it won't kick in until like the end of next week. It takes a while to kick in for me. It takes 3 days for most people, and it takes a little bit longer for me to really kick in. And I'm really excited. I can't wait to see the effect. I don't know if I'll do a video or not, because obviously you'll see the results. And I've done so many videos. Yeah, I need to do a video, don't I? Because I need to do a video on the blepharoplasty aspect, don't I? The eyelid surgery, how it looks before and after with Botox. So I will. I'll come and do a video. I think that's everything to tell you. Is it everything to tell you? Yes. I don't know what to do about this droopy eye. I really don't know what to do about this droopy eye. It doesn't affect anything, because I can close my eyes without it drooping. I can open my eyes. You know, the only thing I can't do is raise my eyes and then look down. As soon as I do that, it drops. So it's not preventing me doing anything. It's other than taking photos of my eye makeup with my eyes looking down. It's just causing me a bit of worry, because like I said, I can see, I don't know if you can even see it now, ever so slightly in photos. I'm like, you know what? It's starting to droop a bit. The Botox should counteract that, but I don't want to find, you know, like in years to come, that without Botox my eyebrows like down there, you know. Like, I want to know why it's happened. I need to do a bit of Googling maybe, don't I? Because I haven't, well, did I? I probably did at the time, but yeah, I'm not sure what to do. Let me know what you think. Okay, that's everything. I shall list all of my makeup, etc. in the description. Thank you so much for watching. Congratulations to everybody that has had a good experience. And actually, let me just say before I go, don't let the fact that it hasn't worked for me put you off, because throughout this process, I have had about 6 or 7 people telling me and sending me photos, and they've had amazing results, and I'm so happy for you guys. It's amazing. I think there's a lot of you that have just like really been lifted physically and emotionally and had really, really good results. So I am one of the rare cases, you know, and it's good that I can come and share this with you, because hopefully it means that you can ask the right questions and you're aware of this being a potential, and you know, hopefully this will help people. But don't let it put you off, because it doesn't happen to many people from what I can see. I haven't ever heard of anybody else having this problem. So yeah, don't let it put you off. It can and does work for most people. So yes, thank you very much for watching, and I'll speak to you again soon.